Hi everyone, this is Anna Walton from the Tennessee Justice Center. We're going to get started in about 5 minutes. I wanted to do a quick sound check, so if you can hear me, please type into the question box that you can hear me. And Kanika, would you mind speaking as well?
Hi, this is Kanika Young.
Okay, just type into the question box that you can hear both of us. Thank you. Okay, I think we're going to go ahead and get started. My name is Anna Walton from the Tennessee Justice Center, and this is the Insure Kids, TennCare, and CoverKids Eligibility and Enrollment Training. Insure Kids is a statewide campaign to enroll every eligible but uninsured child in Tennessee. And this webinar today is just going to go over the basics of the enrollment process, eligibility requirements, and what you can do to help insure every uninsured child in Tennessee. The webinar will be about an hour, depending on question and answer. Just type your questions into the question box whenever you have them, and we'll answer those at the end. The slides will be sent out, as well as a recording of the webinar. And Kanika Young, our Director of Children's Health at TJC, will be leading the webinar today. Kanika?
Thank you, Anna. Hi, everybody. Thank you for joining us today. So as Anna mentioned, we are going to share some basic information with you about the TennCare and CoverKids program in Tennessee and how families who need enrollment assistance can get on the programs. So we can go on to the next slide. So first, we know that there are some obvious benefits of kids having health coverage. They can get the medical care that they need if they become sick or injured, and as well as just having those regular visits for preventative care like immunizations, vaccines, etc. But there are some long-term effects of kids having comprehensive health coverage. There have been studies to show that on average, kids who have this coverage do better in school. They miss fewer days of school due to illness or injury, and as a result, they're more likely to finish high school, to attend college, and even graduate from college. They have fewer emergency room visits and hospitalizations as adults, and they earn more as adults. So the main takeaway is healthy people lead healthy and productive lives. So it's really important to give children that early foundation of health that will set them up for success throughout life. Next slide. A lot of people may be surprised to know that almost every child is eligible for something. We're going to be talking about the public coverage options that are available to low-income or middle-income families, but there are, a variety of ways that children can get coverage. The campaign Insure Our Kids is trying to connect with those children and pregnant women who are eligible for these public coverage categories that may not be enrolled due to maybe not knowing about the programs or maybe not having assistance to get enrolled. But again, almost every child is eligible for something. Next slide. So I mentioned public coverage categories. What we're talking about are the TennCare program, which is Medicaid, the CoverKids program, which is CHIP. CHIP stands for Children's Health Insurance Program, and TennCare Standard. These are the categories of coverage that we're focused on today, and so we'll talk about what these programs are, what's covered under them, and how do you enroll. Next slide. So starting with TennCare. TennCare is Tennessee's Medicaid program. Medicaid is a federal-state partnership where the federal government pays a portion of the cost and the state chips in a portion, and the federal government sets certain parameters in terms of what needs to be covered and who can be eligible for the programs, but there's some flexibility that states have to administer the program as they see fit for their citizens. The running joke is, if you've seen one state Medicaid program, you've seen one state Medicaid program, because they all vary, and they have that flexibility to shape the programs to meet the unique needs of people in that state. But in Tennessee, there are about 1.5 million people enrolled in TennCare. This is a very important program because it covers over half of all of Tennessee's children. It covers half of all babies born in Tennessee and provides major funding to the neonatal intensive care units in the state. Children who need neonatal intensive care can rely on these units to be state-of-the-art and to have the staffing and funding that they need to operate at the maximum level, in large part because Medicaid dollars help those units to stay up and running. It is the single most important payer for services for children with severe healthcare needs. As you can imagine, if you have a child who has some severe healthcare need or special requirements or needs to maintain their health and to be able to go to school and function as people in society need those supports, then Medicaid is there for those situations. And a lot of times you have something like nursing services or other special needs to help these people with severe healthcare needs or disabilities. And those things are often not covered by private insurance. So that's why Medicaid is really important for those families, because it does cover things that other commercial plans may not cover that are necessary for those kids. Next slide. What makes TennCare so great is, especially for children, is that it has a standard called Early Periodic Screening, Diagnostic, and Treatment, or EPSDT. I know it's a mouthful, but EPSDT essentially means that whatever a child needs that is medically necessary, they are entitled to receive on TennCare, regardless of whether the TennCare benefit package includes that item. That requires children on Medicaid receive any periodic or interperiodic assessments of growth and development, immunizations, lead poisoning testing, comprehensive vision, dental and hearing services, and all other medically necessary diagnostic and treatment services. So it's really great that the federal government has imposed this standard. This is one that states cannot veer from. But a lot of times people may not be aware of this standard, particularly those who are on TennCare and they need some service. If they have been denied and it's a child who's been denied some service, it is important for people to know that this standard is in place so they can appeal any decisions that would deprive a child of some medically necessary service. So we really want people to understand this unique feature and benefit of TennCare. Next slide. So CoverKids is another health insurance program in Tennessee that is based on a federal-state partnership. The federal program is generally called CHIP, and it is also set up where the federal government is paying a portion of the cost, with the state chipping in a smaller share. The CoverKids program in Tennessee is actually funded a little over 99% by federal funds. And so Tennessee is able to cover a lot of children with very small state dollars. As of fiscal year 2017, there were over 103,000 children enrolled in CoverKids, which is slightly down from past years where enrollment was about 106,000. This decline in numbers could be due to several different factors. It could be that children who were eligible for the program were no longer eligible because of a change in income, or it could be that the children enrolled were just in the state for a short time and they moved to another state. So there's a variety of things that could be going on, but we want to make sure that the reason for that decline is not related to kids not being enrolled in the program when they should be, when they are still eligible. CoverKids provides also comprehensive health insurance for children who are 18 and younger and for pregnant women, regardless of immigration status. So that's a really important one. Pregnant women who are not lawfully residing in the state are still entitled to prenatal care because the child that they will be giving birth to will be a U.S. citizen. So it makes sense that we want to make sure that the pregnant woman is getting all the prenatal care that she needs to deliver a healthy baby. Next slide. The CoverKids benefits are slightly different from TennCare. The EPSDT standard that we talked about does not apply to CoverKids. Their benefits are really patterned after the plan that Blue Cross Blue Shield offers to state employees. So if you're familiar with the state employee package, which is fairly good benefits, then that would be the similar benefit structure for CoverKids. In fact, Blue Cross Blue Shield is the insurance company that administers the CoverKids program for everyone enrolled on CoverKids in Tennessee. We have what's called a managed care set up for for these programs. And so instead of TennCare as a state agency administering the program, they contract with insurance companies, in this case, Blue Cross Blue Shield of Tennessee, to administer the program, to set up the network of providers that people can go and see who have the insurance, and to process claims. So that's the function of Blue Cross Blue Shield for CoverKids. It does provide a low-cost comprehensive health coverage, and it covers preventative health services, doctor visits, hospital visits, vaccinations, well-child visits, as well as developmental screenings and mental health. Children can also get vision and dental care as part of a add-on package where you would have some additional copay probably for those services. Next slide. CoverKids has a cost sharing feature. They don't have premiums, but you may have to contribute a copay depending on income as well as the service. But the cost sharing cannot exceed 5% of the family's income. As well, for well baby and well child care, including immunizations, there's no cost sharing. So you can get those services without having to pay a copay. Next slide. So the third public coverage category that we mentioned at the beginning is TennCare Standard. This is sort of a hybrid program between TennCare and CoverKids because it has similar features in terms of the benefits as TennCare, but the funding comes from CHIP funds. So TennCare Standard is specifically for children under the age of 19 that are on TennCare but became ineligible for various reasons. They are able to roll into TennCare Standard and remain on that program until they reach the age of 19. So let's say they are 8 years old when they are enrolled in TennCare, but maybe their family's income increased or there was some change in their status that made them no longer eligible for TennCare. They can then roll into TennCare Standard and remain on that program as long as they meet the other eligibility requirements up to the age of 19. So what are those other requirements? One is you can't have access to group health insurance. That means for a child, if their parent has employer-sponsored insurance through their employer and they could add the child to that plan as a dependent, then that would be access to a group health insurance option. What isn't considered group health insurance are the plans that people are able to buy on the marketplace under the Affordable Care Act. Those are individual plans, they're not group plans. So just because someone could go on the marketplace and purchase a plan and put their child on there as a dependent does not make them eligible for TennCare Standard. The other requirement is that the child must be a U.S. citizen, U.S. national, or eligible non-citizen, and there are some income requirements. First, if the child is below 211% of the federal poverty level, that's what FPL stands for on the slide, which translates to about $52,000 for a family of 4. Or if they are above that income level, but also have a qualifying medical condition, then they can still roll into TennCare Standard. And what's considered a qualifying medical condition would be any sort of serious condition that would have prevented them from getting health insurance prior to the Affordable Care Act. So as some people may recall, before the Affordable Care Act, insurance companies could engage in an underwriting process where they could send you a questionnaire that asks you all about your health history and your current conditions. And they could use that information to decide either to not write a policy for you, so you would be excluded from buying insurance, or they would use that information to factor into how much premium to charge you. So those kind of costly conditions, such as juvenile diabetes or cerebral palsy or any sort of serious chronic condition, could be a qualifying medical condition. There's a long list that TennCare refers to for that determination. Next slide. So this gives you an overview of the numbers of children and where they fall into these different coverage types. So there are about 1.5 million children in the whole state, and the majority of them are on TennCare. As I mentioned before, about half of kids are on TennCare. There's over 100,000 who are on TennCare Standard and CoverKids. Those two categories are reported as a combined number because it's the same pot of money. So those are CHIP-funded services. Then the next category is the marketplace. So that's the Affordable Care Act or healthcare.gov individual plans that covers about 21,000 children. And then you have 686,000 who are on employer-sponsored plans. So they're listed as dependents on their parents' insurance plans, more than likely. Then you have 53,000 uninsured. That's the number that we are focused on as part of the Insure Our Kids campaign, to bring that number down as close to zero as possible. It's sort of like, finding a needle in a haystack to figure out of the 1.5 million children in Tennessee, where are these 53,000 who are not insured? And even more so, where are the ones who are uninsured, but we know are eligible for these programs based on census data that tracks household size, income, and the ages of the people. So 34,000 or a little over 34,000 children we can estimate are not insured but are eligible for these programs. So we want to make sure that they are getting this information. Next slide. There's a breakdown of the uninsured numbers of children in the state by county. So Shelby County is in the darker orange color. They have an uninsured children rate of over 11,000. Davidson County is also dark orange, and they have almost 7,000 children who are uninsured. And then Knox County is the third highest in terms of number of uninsured children at over 3,000. So we really want to reach providers and others in these counties who work with families and to share information about the TennCare and CoverKids programs for their clients. Next slide. So I mentioned earlier one of the categories for TennCare Standard looked at where you fall on the federal poverty level. This is a chart that shows how you cap those or what dollar amounts correspond to those different caps in the program. So at 211%, that is the upper limit for TennCare Standard. Unless the person has a qualifying medical condition, then they could be over 211%. 250% of federal poverty is the far right column. That's the upper cap for the CoverKids program. So looking at a family size of 4, if you want to know if a child in that household would theoretically qualify for CoverKids, then you would look at the family size line and go over to 250% of poverty, and you see that their annual income couldn't exceed $61,500. And that's a considerable amount of money. And some people may think, oh, I probably don't qualify for anything because, that's about middle income. But they need to know about CoverKids because that is still an option for people at that income level. And then the other percentages correspond to different age groups within the TennCare program. So whether a child in a certain household would qualify would depend on the number of people and how old the child is. And so you could look at that corresponding percentage and family size to figure out the dollar amount. Next slide. So there, in terms of the categories of people who qualify for TennCare, TennCare is not just a program for low-income adults or children. You also have to fit into a category of eligibility on top of the income limits. So this chart gives an overview of what those categories are for who's eligible, along with the income percentages that would set the cap for their category. So for example, for a newborn, along the bottom axis, you see the ages. The first column is age 0 to 1. They could qualify if they are up to 195% of the federal poverty level. Above that level is CoverKids. So you see where CoverKids kind of stands on the shoulders of the Medicaid program to help families who may be above that income level but still can't afford private health insurance. The next category that I'll point out is medically needy. The reason that that arrow continues above the 250% level is because for people who have significant healthcare bills, they can subtract their healthcare expenses from their income to come within the medically needy spend down category and still enroll in TennCare. So even if a family is above the income cap, this special category exists to help those who have significant healthcare expenses. And as we all know, those healthcare bills can really add up and may be a burden on families and prevent them from being able to provide for themselves in terms of, you know, keeping a roof over their head and food on the table and also paying those bills. So that's in consideration of those people who have those special healthcare needs. TennCare Standard is reflected, again, at 211% of federal poverty level. Children can enroll into TennCare Standard, and if they are above that, they still may qualify if they have a qualifying medical condition. The other categories that we'll point out are, of course, for pregnant women. That's the first blue bar towards the middle of the column. As a pregnant woman, you can qualify for TennCare at up to 195% of the federal poverty level. And if you are above that, you may qualify for CoverKids up to 250% as a pregnant woman. And then the orange column is representing former foster care youth. So for young people who are in state custody as foster kids, they automatically get TennCare by virtue of being in the state's custody. If they age out of the foster care system, which that happens when a child turns 18, they can still remain on TennCare regardless of their income until they turn age 26. This is a fairly new provision that was enacted with the Affordable Care Act. A lot of people know about the feature of the Affordable Care Act that allows parents to keep their children on their insurance as dependents until they turn 26. Well, this is the companion for foster kids who don't have parents to put them on their insurance, so they can stay on TennCare. Next slide. So we'll go through a couple of hypotheticals to demonstrate these concepts. First, we'll talk about Eli and Amy. Eli is 28 and Amy is 5. Amy has been on TennCare, but they recently got a bump in income from $1,300 a month to $2,750 a month, and they don't have any other resources to consider. The resources I'll just mention, in addition to looking at income for certain categories of eligibility for TennCare, you would also factor in the family's resources to see if they qualify. So you can see, referring back to the income chart, that for a household size of 2, which Eli and Amy are, they're at $2,750, they are slightly above the income cutoff for their family. So Amy would no longer qualify for TennCare, but as we'll see on the next slide, Amy would qualify for TennCare Standard. Again, she's 5 years old, she was on TennCare, she became ineligible due to the increase in income, so she can roll into TennCare Standard because they are still under 211% of the federal poverty level for their family size. So that's an option available to Amy as long as she meets the other categories until she turns age 19. Next slide. So again, regarding medically needy spend down, you would subtract healthcare related bills from the family's income and see if they come beneath the spend down limit. You don't have to worry about those actual numbers or doing the math. We just want to make sure people are aware of this concept. So if you come across families who think they don't qualify for TennCare, but they have significant healthcare bills. And those bills that are considered for this medically needy spend down calculation is a pretty exhaustive list. So it includes what they pay for health insurance, what they pay out of pocket when they go to the doctor or the hospital, any amounts they spend on prescription drugs, even over-the-counter drugs up to a certain amount, as well as guide dogs or home health supplies. A variety of things can count for this category. So just be aware that for people who have significant health care needs, they may be able to qualify under this spend down category. Next slide. So here's our next scenario. We're looking at Elroy, who is 10 years old. He is in a family size of 4, the Jetsons. Unfortunately, the robot Rosie doesn't count for the family size, but they have a combined income in their family of $4,500. And then you see that there are medical bills that Elroy has, as well as his mom and dad and sister. So for medically needy spend down, you are considering the whole family's medical bills, not just the person that's who's applying for the program. And then you see they have some money in the bank. But after you do the calculation, you will see that adding up all the bills and subtracting it from the income will bring this family under the spend down limit for their family. So on the next slide, we'll see that Elroy is eligible for medically needy spend down. Next slide. Another hypothetical is for newborn Catherine. Catherine is 2 months old. She has been in the NICU since birth. Her parents have considerable income at over $9,000 a month, and they have some money in the bank. But there is a special category of TennCare that we haven't talked about yet, which is institutional TennCare. So on the next slide, we know that for babies who are in the hospital for more than 30 days, their parents' income no longer counts for determining their eligibility for TennCare. So institutional TennCare is a way for hospitals and other long-term care providers where someone is actually an inpatient at their facility, they can qualify for TennCare. I don't think mental health facilities count, but any sort of residential medical services or hospitalizations will count for institutional TennCare. And we'll share some information on the coming slides about how to enroll in those types of programs. But we have, I believe you can advance to the next slide. There may be, yes. So Sheila and Jase Hobbs are former clients of TJC. And this is a good illustration of several of the concepts that we've talked about. First, Jase was born to a mother who had substance abuse dependency. So he was born with a whole host of issues and medical complications that required him to be in the hospital for several months. Sheila and her husband, Mike, found Jase and decided to adopt him. They visited him while he was in the hospital. They learned about all his conditions, and then they adopted him when he was, before he turned 2 years old. But even after adopting him, they weren't able to take him home because Jase required a breathing tube and 24/7 nursing care related to his conditions, and they could not afford that care. Sheila and her husband had a plan on the Affordable Care Act marketplace, but they couldn't afford to add Jase to that plan, and even if they could, their particular plan didn't cover the home nursing services that Jase needed. And so they were, very motivated to bring Jase home, but they needed to have these things in place in order to safely care for him at home. So we worked with the Vanderbilt Children's Hospital to get Jase enrolled in institutional TennCare because he had been in the hospital for more than 30 days and he had a qualifying, he didn't have his parents' income no longer counted in terms of determining his eligibility, then he got on institutional TennCare. So then when he leaves the hospital, of course, TennCare is going to determine, is this person still eligible? At that point, when TennCare reviews it to see, does Jay still qualify for TennCare now that he's at home with his parents, then they will see that his parents' income actually exceeds the income limit for TennCare. But remember TennCare standard, because Jase had TennCare and he is still qualifying as a U.S. citizen, as someone who doesn't have access to group health insurance. Remember, Sheila and her husband had a plan on the affordable marketplace. They didn't have employer-sponsored insurance. So he doesn't have access to group health insurance. He has a qualifying medical condition. So even though they may be above 211% of the federal poverty level because of his medical conditions, they still qualify for TennCare standard. So as long as those conditions continue to be met, Jase can stay on TennCare standard until he turns 19. Next slide. The breakdown of uninsured children in the state just shows that it varies across different income levels and age groups. Older kids are more likely to be uninsured than younger kids, and we want to make sure that we are spreading this information to a wide group of people so that anyone who is thinking they don't qualify or thinking there aren't any options available to them, they can be made aware of these very important programs. Next slide. So as I mentioned, there are individual plans available on the marketplace, which is healthcare.gov. But for certain plans, you can only enroll when it's open enrollment, but that's not the case for TennCare and CoverKids. For Medicaid and CHIP enrollment, it's always open. Next slide. So Tennessee is one of only a couple of states that don't have their own application portal. So Tennessee currently sends everyone to healthcare.gov. That means people who are looking for individual plans, as well as people who want to apply for TennCare and CoverKids. They have to go to healthcare.gov. We know that this may be a barrier for people, either because they don't have access to a computer, they don't have internet access, or they're just not computer savvy or computer literate enough to fill out this application on their own. So we are trying to make sure that to the extent people can qualify for these programs, they get the enrollment assistance that they need to actually complete the application. The only categories of people who don't have to go through healthcare.gov are for certain presumptive eligibility programs that we'll talk about, but also Choices, which is a long-term care program for people with disabilities, and then the Medicare Savings Program, which does not apply for children, so we won't go into those. But those are just 3 exceptions to the rule for everyone having to apply at healthcare.gov. Next slide. It's a good idea for people to gather information that they need to apply for these programs in advance. So this is just a list on this slide, as well as the next one, of the different items of information that people will need. One thing that I'll point out is that for employer and income information for everyone in the household, you can use sworn statements for people who are unemployed or who don't have verifiable earnings. For example, they're paid in cash, or they're just not traditional W-2 wage earners. They can submit a sworn statement saying, this is what I do and this is how much I make, or a sworn statement saying I am unemployed. Next slide. This is just a continuation of that application checklist. In terms of submitting this information, it's a good idea for people to make their best estimate of all of these items that are being requested and to submit the information to the best of their ability. And if for some reason TennCare comes back and they need more information, then they'll have that opportunity to supplement the application. But it's a good idea to kind of have an idea or a sense of all the information that'll be requested in the application. Next slide. So I mentioned earlier that there were a couple of presumptive eligibility programs that don't require applicants to go on healthcare.gov. And so one of those categories is for newborns. There's something called TennCare Deeming, CoverKids Deeming, and newborn presumptive eligibility that we'll talk about. Next slide. First up is TennCare Deeming. TennCare Deeming is for moms on TennCare. The child is deemed eligible for TennCare for 1 year, so they can automatically enroll in TennCare if the mom was on TennCare. Coverage starts on the date of birth for the child, and the way that you would enroll is to call the Tennessee Health Connection at the number listed and enroll the child. This is a way for children to not have any lapse in coverage while an application may be pending for the child to enroll in TennCare. So it's important that while they have this year of coverage, they do put in an application, a full application for TennCare for the child so that they can then have that in place after they turn 1 year old. Next slide. CoverKids Deeming is similar in that it's for moms who are on CoverKids. The child is deemed eligible also for 1 year, but for CoverKids, the coverage starts from the date the mother enrolled in CoverKids, not the date of birth for the child. So it's important for moms to get enrolled in CoverKids as soon as possible so that they can get the prenatal care that they need as expectant mothers. And here, CoverKids has its own line that parents can call to report that the child has been born, and that so that the child can have CoverKids for those first 12 months. But also, this is for moms to have time to put in that full application for their child during that first year of life. Next slide. Newborn presumptive eligibility is for babies who are born to mothers who are on private insurance or no insurance. For newborn presumptive eligibility, the coverage starts on the date of application, but again, the same eligibility criteria will apply after that first year. So if a baby is born and they can enroll in the presumptive eligibility program, the parents will still need to apply for either TennCare or CoverKids to make sure that the child gets that coverage beyond that first year. Next slide. The way you apply for newborn presumptive eligibility is to call the Tennessee Health Connection and enroll the child. You still have to do the application on healthcare.gov, but the child can remain eligible until there's a final decision on that application. So it's just a way for newborns to get that healthy start by getting all the immunizations and checkups that they need in that first year. Next slide. A few best practices to keep in mind for navigating the TennCare and CoverKids application process is remember to sign all documents. In speaking with TennCare about common reasons that applications are denied, they mentioned one of them being a failure to sign the application. That will delay the process, and they will have to reach back out and get those signatures before they can process the application. Remember to answer all questions or write not applicable on these applications. Also, it's important to open all mail from TennCare. TennCare is a program that requires redetermination. So the TennCare agency has to make sure that people who are enrolled in the program remain eligible, and they do this on an annual basis. And sometimes the mail that they send to redetermine if someone's eligibility may not be clear that it's from TennCare or that it's for health insurance. Some people who are on TennCare may not even know that they are because of the managed care aspect of it. As I mentioned in the beginning, Tennessee has a managed Medicaid program so that TennCare doesn't handle the benefits or the claims for the program. They do that through different managed care organizations. And right now, TennCare has contracts with 3 different insurance companies to administer the TennCare enrollment and eligibility. So those are Blue Care, which is a division of Blue Cross Blue Shield of Tennessee, United Healthcare, and AmeriGroup. And so those are the companies whose names would be on the enrollees' cards, and they may not be expecting to see something from TennCare. So it's important that people, recognize TennCare is the Medicaid program, even if they are more familiar with Blue Care or AmeriGroup or United. So it's important to know the names that are associated so that they're not missing important information from TennCare. And also responding to any questions or inquiries that TennCare sends to make sure that you are providing information to show that you're still eligible for the program. It's also important to make sure TennCare knows about any address changes. One thing that has been a big issue recently is the redetermination process, because TennCare hadn't done it for a few years, and then they just started up in the past couple of years. In the fall of 2017, they decided to start back doing this redetermination process. They may not have the latest and greatest address information because they hadn't been communicating with people for a while. And so they were sending packets out, packets of pages, almost 100 pages to people, and they were not receiving them, or they didn't know what they were, and so they ignored them. And those people have been losing their TennCare coverage, and they don't realize it until they go to the doctor's office or until they go to the pharmacy to pick up medications, and they are informed at that time that they don't have health insurance. And so we want to make sure people know that these packets have been going out and that it's important that you respond to it and provide all the information that TennCare is requesting. Next slide. So as part of the Insure Our Kids campaign, we have partnered with several organizations to help people enroll in TennCare and CoverKids. If you need help applying, this is the Get Covered Tennessee hotline, 1-844-644-5443. The Tennessee Healthcare Campaign has volunteers who answer that line, and then they refer people to either Family and Children's Service or other entities that provide enrollment assistance. So they will do the initial screening, ask some pretty basic questions about income and household size, et cetera, to see if the person may qualify for TennCare or CoverKids. And then they will refer that person to a navigator who's local, that they can either continue the application process over the phone, or they can meet with them in person, either at different local health departments or public libraries or other public spaces where navigators are willing to go and meet with people. Another resource that we want to share with everybody is for people who have already applied and been denied for these programs, or if they are on the program and they need help filing an appeal because they've been denied. Toll-free number is listed on the slide as well. And we help individual clients navigate enrollment and also appeal any sort of service denial. Next slide. A couple of barriers that we are aware of for driving down the total number of uninsured children in the state do relate to income. For some families, they will be above the upper threshold, and they may not have medical bills that would bring them under the spend down limit, or other qualifying conditions that would allow them to enroll in the program. So income may be a barrier. Immigration status for TennCare and CoverKids, the child has to be a U.S. citizen. For pregnant women, for CoverKids, she may enroll regardless of immigration status, but it's still a problem even for lawfully residing immigrants. So for children who immigrated to the United States at a young age, they're not U.S. born citizens, but they're here lawfully under some green card status or other immigration status, they have to wait 5 years before they can enroll in any public benefits like TennCare or CoverKids. So this 5-year bar is in place in Tennessee, and we have not chosen to exempt or make an exception for this category. So that is something that's a barrier. Another thing is parents switching employers. Sometimes if you start a new job, there may be a probationary period where you don't qualify for those benefits, including insurance, until maybe after 60 days or so. We want parents to know that CoverKids can be a short-term option for children. So parents switching employers can enroll their child on CoverKids or TennCare for whatever period they need it, and then they can add their child to their plan after they get that insurance in place. The family glitch that's noted here is a situation created under the Affordable Care Act that just shows that there's an interpretation issue with how cost-sharing premiums and subsidies are determined. When they look at whether someone has access to affordable health insurance, they don't consider the cost of adding dependents to the employer's plan. So as an individual, you may be able to afford coverage for yourself from your employer-sponsored plan, but you wouldn't be able to afford it if you added your child to that plan. And unfortunately, that's not what's considered when you determine whether someone can access a group health insurance plan or whether they qualify to purchase a plan on the individual marketplace. And then death of a parent. For families who are adopting children, this is just a reminder that you may want to look into adding a provision for the child to receive TennCare in your adoption agreement. That's something that adoption lawyers may or may not be familiar with, but we just want to flag that if you work with families that do adoption, that's something to consider for that adoption agreement. Next slide. So we're very happy and proud to share this information about the Insure Our Kids partner organizations. The Tennessee Justice Center is leading that campaign, but we couldn't do it without the help of our partners who are listed here on the slide. These are organizations who have committed to sharing information about Insure Our Kids and helping to spread public awareness about the availability of these programs and how they can help people get enrolled. If you or your organization are interested in sharing materials, passing out flyers to families, or referring other people to learn about these programs, we would love to hear from you. Next slide. So thank you for your attention. As I said, we're here as a resource. If you want more information, you can go to insureourkids.org. And if there are any questions, I'm happy to answer them now.
Yes, there's a question. Well, there's a couple questions. So unfortunately, there's not CE credit for this webinar, but TJC in general offers a lot of continuing education credit for our training. So you can go to our training page on our website to see what's available, and it'll usually denote if there's credit available or not. And the next question is, how do you apply for medically needy spend down? Can you go?
Yeah. I'm sorry.
Can you hear me?
Yes. The question was, how do you apply for medically needy spend down?
Yes.
So for the TennCare application, when you submit the information, you can write on there that you think you may qualify for medically needy spend down, and you may not be determined eligible for TennCare on that first pass because they don't always screen for all those categories of eligibility, but we can help with filing an appeal. So if you don't have an opportunity to be determined eligible on that first pass, you can file an appeal explaining, this is why I qualify for TennCare because of medically needy spend down. So it's the same application process, but it may be missed on the first pass. So that's why you may have to do a follow-up appeal and specifically say, look, consider me for medically needy spin down. Are there any other questions?
No, it doesn't look like there are any other questions.
Okay. Well, thank you all for joining
actually,
us.
one more. I'm sorry. Is it best to apply for TennCare with a paper application or on the health insurance marketplace?
You have to apply on the healthcare.gov. There's no application system to accept paper applications, except for at the health department for pregnant women. They still have in-person assistance, or they're supposed to at the health department. But what I've heard is they still tell people to go to healthcare.gov to submit the application. So there's no other, if you do a paper application, there's a fax number for specifically for pregnant women, but there's no way to submit a paper application for anyone else. You would have to do it on healthcare.gov.
Okay, it looks like that is it.
Okay. Well, if anybody else...
Sorry.
I was just going to say, if anybody has any other questions, you can visit insureourkids.org, and there are numbers listed to call the Tennessee Justice Center as well as that Get Covered hotline, and they may be able to answer questions. My personal email address, if you have questions, is kyyoung@tnjustice.org.
Great. I'll send out the slides and a recording of the presentation after this.
Okay. Thank you. Goodbye.
All right. Thank you.